Passengers wearing protective suits were evacuated from a luxury cruise ship near Spain's Canary Islands after a deadly Hantavirus outbreak on board. They were ferried to shore in smaller boats, transported in sealed buses, and flown back to their home countries under medical supervision. The Dutch-flagged vessel MV Hondius, carrying nearly 150 passengers and crew from 23 countries, departed from Argentina's Ushuaia in April and was on a transatlantic expedition when passengers began falling ill. 3 people, a Dutch husband and wife and a German woman, died in the outbreak. Multiple others were also infected or placed under medical observation. Some countries have already imposed strict quarantine measures. Greece ordered hospital isolation for 1 passenger, while France said 1 evacuee showing symptoms had been placed under strict quarantine. Meanwhile, the authorities in the US said American passengers will not necessarily be quarantined at a specialized center. Depending on the estimated risk, they can choose to go home without exposing other people on the way, a top official said. Hantavirus is a rare but potentially deadly disease which usually spreads through rodents. Health officials say the outbreak aboard the ship involves the Andes strain of Hantavirus, the only known variant capable of spreading from human to human. That has raised concern among international health agencies. The World Health Organization has confirmed multiple linked infections from the ship. However, WHO officials say the overall global public health risk remains low.
This disease is not COVID, and we have said it many times as WHO. And when we say this, we don't take it lightly. And then, of course, the other issue I'd like to say, which I also indicated in my message to the people of Tenerife, is the risk to the population, to the local population, is low. One is because of the very nature of the disease itself, but second, the risk is low because the Spanish government has made all the preparations to prevent any problem. So I want the local people, the Tenerife people, to really listen to us clearly and trust what we say.
There are currently no vaccines or specific antiviral treatments for hantavirus. Patients are mainly treated through supportive medical care and isolation. The cruise ship is now expected to leave the Canary Islands and return to the Netherlands with a limited crew on board.